Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Hira Zahir and today I am going to teach you about appendicitis. What is the definition? Appendicitis is an inflammation of the vermiform appendix that develops most commonly in adolescents and young adults. Appendicitis is an acute inflammation of the appendix. Now let's talk about the anatomy and physiology of the appendix. The appendix sits at the junction of the small intestine and large intestine. It is a thin tube about 4 inches long. Normally, the appendix sits in the lower right abdomen. Clinical features include pain, severe colicky type initially felt in the umbilical region, and it is due to the distension of the appendix. Vomiting, anorexia, fever, hematuria, it is uncommon. Constipation. Risk factors include infection, possibly stomach infection that has traveled to the side of appendix. Obstructions such as hard pieces of stool getting trapped in the appendix leading to the infection of the appendix, extreme of age and previous abdominal surgery. These are the risk factors. Causes includes acute appendicitis, which seems to be the end result of the primary obstruction of the appendix. Fecolith. Once this obstruction occurs, the appendix becomes filled with mucus and it swells. This continued production of mucus leads to increased pressure within the lumen and walls of the appendix. The increased pressure results in thrombosis and occlusion of the small vessels and stasis of lymphatic flow. Now let's talk about pathophysiology. First of all, obstruction of the appendical lumen inside the appendix, then buildup of mucus in the appendix constantly secreting mucus, then appendical lumen pressure increases, blood flow into the appendix decreases, oxygen delivery decreases, which led to hypoxia, ulceration or lesions of the appendix mucal lining, promotes microbe invasion, for example, bacteria, inflammation and swelling of the appendix, which results appendicitis. Now let's talk about the types. There are two types of appendix: acute appendicitis and chronic. Acute appendicitis is, as its name implies, develops very fast, usually in a span of several days or hours. It is easier to detect and requires prompt medical treatment, usually surgery. Acute appendicitis occurs when the vermiform appendix is completely obstructed, either because of bacterial infection, feces, or other type of blockages. Infection may also cause swelling of the lymph nodes, which then adds pressure on the appendix, cutting off its blood supply. Appendix can be chronic, but it is a rare condition. Chronic appendicitis is an inflammation that can last for a long time. This is rare according to report. Basically, chronic appendicitis means that the appendical lumen is only partially obstructed, causing inflammation. Inflammation worsen over time, causing internal pressure to build up. Diagnosis include based on the results of physical examination, laboratory findings, or X-ray findings. Complete blood count also demonstrate an elevated white blood cell count. Leukocyte count may be exceed 10,000 cells per millimeter cubic, and neutrophil count may exceed 75%. Appendectomy is the surgical method to remove appendix is performed as soon as possible to decrease the risk of perforation. It may be performed under a general or spinal anesthetic with a low abdominal incision or by laparoscopy. So that's all about appendicitis. Thanks for watching.